It's a great pleasure for me to give a welcome address to the participants of the International Plasma Protein Congress taking place today and tomorrow in Berlin. Blood plasma is indispensable. It's a very valuable source material for the manufacture of vital medicinal products. Its biological composition is unique. As a result, it cannot be manufactured artificially but must be extracted from plasma donations. The well-known slogan used by many German donation facilities, "Donate plasma, save lives," is therefore not just an empty phrase. For many patients with rare diseases such as blood clotting disorders or immune deficiencies, plasma preparations are the only medicines available for treatment. Plasma preparations are vital for these patients. The importance of plasma-derived medicinal products also reflects the rising demand for such medicines. The areas of medical applications, especially of immunoglobulins, are increasing steadily, and the quantities used are growing year by year. Even during the pandemic, convalescent plasma donated by persons recovering from COVID-19 rose to significance as a potential immune therapy. This all goes to show that it is very important for us to secure the long-term supply of plasma preparations in Germany and the EU. With its annual collection of some 3 million liters of source plasma, Germany is currently one of those EU member states that collects the most plasma in relation to the total population. However, a large part of the plasma collected annually in Germany is not further processed here, but exported to manufacturing pharmaceutical entrepreneurs in third countries. The COVID-19 pandemic outbreak has clearly demonstrated how indispensable it is for us to secure the supply of essential medicinal products, such as plasma preparations, within the EU as well. From my perspective, it is therefore urgent that we address the need to safeguard and secure the supply of plasma preparations in the EU as we revise its legislation on blood and medicinal products. The aim of EU legislation revisions in this context should be to create prerequisites for plasma collection to take place in all and not just individual EU member states, for the total amount donated within the EU to be increased and for the plasma collected in the EU to also ideally be further processed in the EU. At the same time, it must continue to be possible for member states to use suitable measures to influence the amounts donated nationally. One such measure is compensating donors for expenses. Another is conducting information campaigns. Our joint objective in revising the EU's legislation on blood and on medicinal products must be to ensure an even more reliable supply of plasma preparations in Germany and Europe. I wish you all a very fruitful exchange at the Congress.